going to present 10 tips for a good phacoemulsification. Dr. Ragini, please, from Mumbai.
Good afternoon, everybody. Thank you, Dr. Sanjay Chaudhary, sir. Good afternoon, and everybody. So, okay. Thank you so much. So, the beginner, uh, the expert was always a beginner, and selection is very, very important for good surgery. So, the correct machine, correct patient, trained personnel, a complete setup, and you have to be prepared for any eventuality to succeed. So, first of all, the way you begin and how you set up is very, very important. Now, when we start our surgery, we start with the corneal tunnel. So it is also the site of entry. So we can customize it with regards to the astigmatism of the patient because the patient wants supervision. It is also a safety valve. The corneal tunnel is triplanar, and you have to be very, very careful because if it is large, there will be leakage and the anterior chamber will be unstable. And if it is small, the wound will be tight and there will be heat burns and the wound will be disturbed. It is very important to maintain the square incisional geometry while making the corneal tunnel. So here we will see a video of the corneal tunnel. And we always make a triplanar. So this is the first groove. We go at the limbus, not the clear cornea, because the healing is much better. Of course, to each his own. And then this is the second plane where we enter with a 2.6 and dissect in the stroma of the cornea to make a tunnel. And we go inside the substance of the cornea, and then we make an entry with a 3.2 blade. Now, trying to make this as square as possible is called as square incisional geometry. That means the length is tried to be made equal to the breadth so that the astigmatism induced by this incision is as little as possible. The tunnel has to be the right size regarding the probe and also the IOL that you want to insert inside the eye. Well begun is half done, so incision is extremely important in the surgery. The side port incisions are very, very important. We use both our hands in phacoemulsifications. They have to be made with MBR blades because we find people making them with 26 number needles and bigger tunnels so that they use a Simcoe through it, but it is not to be done. The blades have to be extremely sharp to prevent a Descemet's detachment. And if you assume that you are at 12 o'clock, even if you are temporal, they have to be made at 10 o'clock and 2 o'clock, making a 90 degrees angle with each other so that your hands are comfortable while using the second instrument. So as you can see over here, so this is the side port with the MBR blade, as you can see over here. Here a side port is made inferiorly. This is for the SICA surgery, but this is just to demonstrate the side port. The blade goes into the stroma for a little bit and then the opening is made so that whatever instruments are put through it are self-sealing like the AC maintainer or they maintain themselves. Side ports are extremely important because they are again ports of entry, and if the integrity of those side ports is disturbed, then your wound is disturbed. Capsulorhexis is integral to phacoemulsification because if you break the rhexis, you break the commitment to phaco. This is important because SICS can be done without the rhexis. It is also the circle of safety, which means that your probe should be in this circle. And if it is not, and if it leaves this circle, the nucleus is thinner and there can be a PC rent. And it enables the in-the-bag IOL of the IOL, which is also the physiological position. So the capsulorhexis is a must. As you can see over here, this is a video, a well-dilated pupil, a great glow, and you can use the 26 number needle or the Utratus forceps, whichever is comfortable to make a good rhexis. The rhexis should be such that it just covers the optic and it is well-centered and circular. So the rhexis is extremely important in a good phacoemulsification. Hydroprocedures follow the rhexis, and they involve hydrodissection and or hydrodelineation. The purpose of this is to reduce the nuclear size, make a nucleus, a free rotating nucleus available, and also the epinucleus which is provided is a buttress plate for safety during phacoemulsification to protect the posterior capsule. The separation or the cleavage of the various planes of the nucleus helps a complete cortical cleanup. Hence, these procedures are extremely necessary. So as you can see over here, this is the hydrodissection, which is used making a 25 gauge cannula on a 2 cc syringe. Multiple points and little fluids is important, otherwise the wave can cause a PC tear. So this is the hydrodissection procedure. It is important to plan which technique you're going to do in phacoemulsification. Stop and chop is the most commonly used. The first division is extremely important. Choosing correct parameters in case of soft nuclei, hard nuclei, different nuclei need different parameters is extremely important so that you don't mechanically push the nucleus and you are actually using the ultrasonic energy. And in case there is a problem, there's no crime to come out, assess the situation, put visco, and then go back in again. Trenching is very important because this is the trench which creates the first division. The trench is nothing but going with the probe and emulsifying the nucleus and creating a wall so that this nucleus can be then divided into two pieces. The depth or the height of the wall is decided on the thickness of the nucleus, and you trench till you can see a good glow. The first division is extremely important, and then which is followed by phacoemulsification, as you can see over here. So this is the trench, as you can see, a well-dilated pupil, the trench. The other instrument is the chopper, and the trench is created in the stop and chop technique. The wall of the trench is deep enough so that you can see the red glow, and then the first division takes place. Once the first division takes place, the nucleus is rotated. It is slightly tilted upwards so that the sharp pieces of the nuclei do not hit the posterior capsule, tearing it. And then again with the chopper and a little bit of trenching, two more pieces are made. And after that, all the pieces are emulsified. An apple cannot be eaten as a whole, and it has to be cut into small pieces. That is the purpose of phacoemulsification, as you can see over here. And the second half is then rotated, brought in front of the phaco probe, and with the trench and the chopper, it is again divided into two pieces. In cases of brown nuclei or hard nuclei, more than 4 pieces can be made because the nucleus is very thick and hard, and hence multiple pieces can be made to enable emulsification and aspiration of the nucleus. During the last piece, one has to be careful that the piece can go back into below the 12 o'clock position, and while coming out after the last piece, one must wait for a second so that there is no collapse. Chamber stability of any machine is extremely important for a good phacoemulsification. So the phaco-dynamics are extremely important in doing a good phacoemulsification. Cortex aspiration is to prevent posterior capsular opacification. The use of side ports effectively to do a complete cortical cleanup really helps you in 360 degrees removal of cortex. We use a manual AC maintainer and the Lanez aspiration cannula because we do a large volume of cases and they can be autoclaved easily. They're very economical, safe, and reusable. So as you can see over here, so once this is the cortex aspiration, as you can see, with the irrigation and aspiration cannula, the irrigation maintains the anterior chamber and the Lanez aspiration cannula helps to do a complete cortical cleanup. In case of necessity, so you can see the 12 o'clock cortex be removed. The ports of the AC maintainer and the aspiration can be interchanged for a complete cortical cleanup. For any automated irrigation aspiration cannula can also be used. Whatever works in your hands and whatever is helpful to you can be used. During IOL implantation, one must remember not to injure the tunnel. It is okay if the incision is 1 millimeter extra, but making or injuring a tunnel causes it to become friable and it can be dangerous with respect to endophthalmitis. Correct injectable system should be used, and it should be positioned in the bag, the IOL, and the visco should be aspirated. So as you can see over here, so this is the cortex, which is so cortex has been completely aspirated, as you can see. The remaining bit of cortex is being aspirated with the irrigation aspiration cannula. The beauty of this is that even the posterior capsule can be polished, and then the IOL can be put in place. So the incidence of posterior capsular opacification is decreased. This is the injection of the IOL inside the bag under the BSS, because the AC maintainer is used. And the IOL is then placed into position in the bag. It gently opens. There is one slide which is remaining, and I'll show you only one, which is very important to seal the tunnels. The closure of the wound is extremely important in any surgery. So sealing of the incisions are very, very important. One must observe and learn properly. A happy patient is equal to the happy surgeon. Maintaining the patient's welfare is extremely important. Thank you so much. I took about 5 to 10 seconds extra. I'm really sorry for that. Thank you so much for giving me the opportunity to present. Thank you so much.
Thank you, ma'am. Thank you for a wonderful